A pharmacist is someone who dispenses prescription medication to patients and offers expertise in the safe use of prescriptions. They also may conduct health and wellness screenings, provide immunizations, oversee the medications given to the patients, and provide advice on healthy lifestyles. To become a pharmacist, you will need to obtain a doctorate's degree in pharmacy. This requires a bachelor's degree and an additional 4 years of schooling at an accredited pharmacy school. A pharmacist is required to get a license at the state level. They also must complete 1 to 2 years of residency in order to begin practicing as a pharmacist. Altogether, it will take at least 10 years to become a pharmacist. Pharmacies are the largest employers of pharmacists. Hospitals may also hire pharmacists to use to their convenience. Pharmacies are located all over the world. States like Florida, Texas, California, and New York have some of the highest employer rates of pharmacists. Entry-level pharmacists earn a median of $104,000 annually. As they gain more experience and time practicing in the field, they can earn up to approximately $150,000 per year. Pharmacists are wanted all over the world, so it is a great area to look into if you don't know where you want to settle down in the future. Employment of pharmacists is projected to grow 6% from 2016 to 2026. Demand is projected to increase for pharmacists in a variety of healthcare settings such as hospitals, but decrease in some traditional settings such as grocery stores because of the increase in online pharmacy sales. Additionally, the turnover rate for pharmacists has decreased to 5.6% in 2013 from 7.1% in 2012. A pharmacist's work environment is typically well lit and ventilated. It is also important that the pharmacist's environment is sanitary. There are certain times in which a pharmacist will have to work with hazardous products, and they must wear protective gear such as masks or gloves. Pharmacists have to be incredibly knowledgeable about the composition, uses, and side effects of any and all prescription drugs. They have to be able to answer any questions someone might have about their prescribed drug. For example, if that drug may interact a certain way with another drug. Pharmacists receive an order for a prescription from a healthcare practitioner, which they prepare and issue to the patient. They can also offer advice to the healthcare practitioner because of their extensive knowledge on the makeup of drugs. Pharmacists can also monitor patients to determine the effectiveness of their specific drug use. Pharmacists are not required to join a union, but they continue to discuss the possibility of unionization all across America. The pharmacy industry is getting larger and thus more out of control. There are also no professional associations that you must be a member of to practice pharmacy, but there are examinations that one must pass to practice that are administered by the National Association of Boards of Pharmacy. The pharmacist occupation is divided almost equally between males and females, with females having a slight majority. This is unlike doctors, which males make up the majority, and nursing, which females make up the majority. Related occupations of pharmacists include pharmacy technicians who help pharmacists dispense prescription medications to customers, and physicians who examine patients, take medical histories, and prescribe medications that the pharmacists have to then distribute. According to the American Association of Colleges of Pharmacy, pharmacists enjoy a wide variety of career opportunities, including patient care, scientific research, and innovation. Pharmacists have also stated that their top reasons for entering the field include wanting to help people get well, working directly with patients, being an important member of the healthcare team, having job mobility, stability, and flexibility, and working with the state-of-the-art technology. One of the group members, Jada, is an aspiring pharmacist. Her work style fits that of a pharmacist in the sense that she enjoys being hands-on in whatever task she is performing. She is also extremely particular and precise when it comes to something needing to be exact. She would envision the first 5 years in her career as shadowing an experienced pharmacist to understand and gain hands-on practice in the field. The next 10 years of a pharmacist's career would consist of conducting hands-on tasks that involve dispensing medicine for patients and probably even moving on to teach students about the job and educate them to become pharmacists. Her personality type fits that of a potential pharmacist because they are known to be an achiever, loves to learn new ideas, and tries their best to avoid confrontation. These 3 personality types suit Jada because she is an individual who enjoys learning, avoiding confrontation in people who condone such activities, and she strives to be the best person she can be.